Right. Just going to start bilateral lip revision. The main issue here is the fact that the lip is stuck. The muscles are all attached onto this part of the upper jaw, the prolabium. It needs to go inside, but it's not. So we'll have to detach and reattach the muscles. I'm also going to do a little bit of scar revision here. This baby had their lip done a few months ago in a North Indian city. And now I'm just going to revise this and get this stuck lip with probably going to create a lot of sulcus, a normal looking one. Okay, marking. I've just completed with this surgery. This patient had stuck lips. Can you put the retractor gently? I'm going to show, yes, what has been done. So you see there, now the lip is totally free from the premaxilla. There's a nice sulcus depth that we've achieved. Just make sure the sutures everywhere on this aspect. So it's got a good mucosal cover. These muscles are going to be in their new position forever now. A small revision on this side as well. Yeah, just okay.